My name's Nichola Sanderson and I'm the Deputy Director of Nursing. This is my colleague, I'll let her introduce herself.
Hello, my name's Amanda Bailey. I'm the Smoke-Free and Physical Health Lead and I work closely with the Infection Control team.
Today I just wanted to talk to you about personal protective equipment, PPE. We want to be able to dispel some of the myths and some of the rumours that are going around, and also assure you that we do have stock coming in on a regular basis into our warehouse. I'm going to ask Amanda to talk to us about some of the issues relating to coronavirus and how this might affect people. Amanda.
Yes, so firstly I'd like to explain how the virus is transmitted between person to person. It is transmitted mainly between touch and through the mucous membranes of the body. So that means your mouth and your nose. So if you touch something that has been contaminated by the virus and you don't wash your hands and then you go and touch your mouth or your nose or your face, then that virus can enter your body through your mucous membranes. That is the main way the virus is transmitted. There is a second way that the virus can enter the body, and that is through breathing in the particles if somebody sneezes or coughs whilst they're in your close proximity to you. That's why we're asking for social distancing, and that's why the rule is to be stood at least 2 metres away from somebody, because if you're in that radius you could be at danger of breathing the particles in. But it does mean that you would have to be in their company for 15 minutes, and it's estimated that 15 minutes before it would cause you any harm. So this is the secondary way it can enter the body. So that's why it's important that overall the key rule is to make sure you wash your hands after any contact with any service user or any visitor or any member of staff which is within the 2 metre guidelines. So the important rule, wash your hands or hand gel if you can't get to a sink to wash them.
Thanks Amanda, that's really helpful. What do we need to do if we're going out to visit a patient that isn't suspected of coronavirus and isn't living with anybody that is suspected of coronavirus, and there are no signs or symptoms of the illness within the household?
Okay. Yes, if you're going to visit somebody and they don't have any symptoms, firstly, make sure the nurse that's visiting hasn't got any symptoms, because we want to protect our vulnerable community. So make sure you wash your hands before you visit that person, and make sure you are symptom free before you enter the house. Check with them when you get there that they are symptom free, and if they confirm that they are, then you would make sure you wash your hands before visiting them, have your contact with them, keep within the 2 metres social distancing if that's possible, but ensure that when you leave the property you wash your hands or gel them and wash them at the earliest opportunity to prevent any cross-contamination.
Great, thanks Amanda. So, what do we do if we're going out to visit somebody who is suspected of having coronavirus or has symptoms of coronavirus, or also lives with somebody who has symptoms of coronavirus or has had coronavirus?
Yeah. So if you did visit them and when you got to the property you were either aware before you got there or when you got to the property you were concerned that they did have symptoms, it's about protecting yourself and protecting that person and cross-contamination for any further visits you've got for the later in the day. So it's essential that you follow our guidelines, which are always updated on the staff net, but currently we are wearing an apron which you'd put on first. Then you'd put your gloves on, and we are wearing some surgical masks which are waterproof, so to avoid any contamination from any particles, so you're not breathing anything in. These are all worn whilst you're in the property, and before you leave the property you need to take those off and dispose of them. You need to take your gloves off first, wash your hands with the hand gel, take your apron off, but ensure that you fold it in on itself, so if there is any contamination on the apron it's being enclosed within the apron. So you want to make sure you bag your equipment up whilst you're in the property in 2 bags. So you've got your initial bag, then your outside bag, and then it will go in a container within your car which is again sealed, so there's no contamination that's going to occur within your vehicle. And then you would take your mask off. Then you need to hand gel, and at the earliest opportunity wash your hands thoroughly with soap and water, decontaminating to prevent any cross-infection for further visits. Ideally you would perhaps leave these visits if you knew they were positive to later on in the day, if you did have other visits to make during the day.
Thanks very much Amanda. So we've heard what our staff need to do when they're out and about visiting people in the community. Talk us through now what our staff that working in our inpatients areas need to do in terms of the kit that they wear and the times that they would wear this kit.
Okay, when there's a service user within the ward that is tested positive or they're in isolation because we suspect they may have COVID, we treat both scenarios in the same way. So you would wear your protective clothing, which I've just explained, apron, gloves and the surgical mask when you're entering the room. You perform your tasks while you're in there, and when you come out you make sure that you dispose of all your equipment into the bags available, and you gel your hands and then wash them as soon as you can at the earliest opportunity.
So Amanda, now can you tell us a little bit more about FFP3 masks, when to wear them, when not to wear them, how to wear them?
As you are aware, there are some masks called FFP3. These are only going to be worn in certain circumstances, as they need to be fit tested prior to you using them, and you need to ensure that when you do put the mask on, in case you need to just swap for a varying brand, that mask does fit correctly when you've got it on. You need to check all the seals by taking deep breaths in and out, and the mask should then puff in and out with your breathing. This ensures that you've got a good seal and that the air is not escaping, but more importantly that the air is not entering and any particles from the atmosphere due to a poor seal. So that's the FFP3 mask. The only circumstances that we are going to be wearing them in the trust is when you are performing a swab. That will only be undertaken by staff that have been trained to do so. Also, in the event of a cardiac arrest, you will be asked to wear the FFP3 mask. Staff are being fit tested for it, the staff that have been trained in ILS, so they will be available within the grab bags, but those are the only two circumstances we are asking staff to wear those masks in the trust.
Okay, thanks Amanda, I'm sure that people will find that really helpful and informative. One of the other things that we're doing is we've got an infection control helpline that is operated 24 hours a day, 7 days a week. So if you're unsure or you've got any queries, please access this service through the switchboard. I'll just hand over to Amanda now, who will do a brief recap.
The key messages I'd like to take away from this video are that hand washing is the most important way to stop cross-contamination, to protect yourself and to protect the service users and those around you. And the second point I'd like to make is the surgical masks that we will be wearing in the trust are what are being used across the NHS nationwide, and they are providing the suitable protection that you need. Thinking back to what we said earlier about the ways of transmission, the main way is to stop it is from hand washing. If we can all get into the habit of doing that and gelling our hands as often as we can, then we're going to hopefully beat this.
That's really helpful, Amanda, thank you. I just wanted to take the opportunity to thank you all for your hard work and dedication to the service. We're not working in the easiest of times. Please keep safe, take care. Thank you.
Thank you.